Hello everyone, I'm going to be demonstrating to you the skills of proper body techniques, how to avoid injuries, and proper lifting techniques while lifting patients or objects. I'm also going to be explaining how improper body techniques can lead to injuries in the healthcare facility.
Body mechanics refers to the way the body is positioned while walking, lifting an object to a person, or simply performing tasks. As we all know, the healthcare profession is a profession that requires quite a lot of physical activity, such as bending the back, flexing of the arms and legs, pushing and pulling patients. And because of this, a lot of healthcare professionals, especially nurses, are at the risk of developing physical strain, back injuries, and fractures. So, one way to prevent this from happening is to practice proper body mechanics. Body mechanics is a broad term used to denote an effort coordinated by the muscles, bones, and nervous system. It can either be good or bad and can be directly related to the occurrence of back pain. Thankfully, there is a field of study concerned with techniques that can be used to reduce the risk of injuries in the healthcare facility. This field of study is known as ergonomics. Ergonomics is a field concerned with adapting to the environment and using certain skills and equipment to prevent injuries. The first technique is to use correct body mechanics at all times. These body mechanics have been given for a reason and they have proven to be effective in reducing back pains and other spinal related injuries that occur frequently in the healthcare facility. Raise beds to a comfortable working height. Remember to lower the bed when you finish your task. Use mechanical lifts and other devices for moving heavy and dependent patients. You don't have to do everything by yourself. Use back support if this is your preference. The use of back support is controversial, but many nursing assistants find them helpful. Get another person to help you when you need to transfer patients who cannot bear their own weight fully. Use a cart to move heavy items. There are 8 commandments recognized globally for use by healthcare workers while lifting objects from the ground. They are proper lifting techniques to ensure the safety of healthcare professionals while carrying out their duties. If you follow these 8 commandments for lifting, you will greatly reduce your risk of injury. The first thing is to plan your lift and test the load. Before you lift, think about the item you are going to move and ask yourself, can I lift this alone? Is it too awkward for one person? Is the path clear? Also test the load to see approximately how heavy it is before lifting. Ask for help. If the load is too heavy or too awkward for you to lift, ask for assistance. Don't do everything by yourself. Don't put yourself at risk. Get a firm footing. Keep your feet apart for a stable base and point your toes out. Bend your knees. Don't bend at the waist. Keep the principles of leverage in mind at all times. Don't do more work than you have to. Tighten your stomach muscles. Use intra-abdominal pressure to support your spine when you lift. Offsetting the force of the load, train your muscles to work together. Lift with your legs. Let your leg muscles do the work of lifting. Don't rely on your weaker back muscles. Keep the load close. Don't hold the load away from your body. The closer it is to your spine, the less force it exerts on your back. Keep your back upright. Whether lifting or putting down the load, don't add the weight of your body to the load. Avoid twisting. Now let us take a look at a quick demonstration on how these commandments are being followed. Whenever you're standing, irrespective of whatever position you're facing, ensure that you are standing upright. Maintain proper body alignment. Avoid slouching. Always stand straight. This is very important. And whenever you're sitting, the same rule applies. Always sit straight. Maintain proper body alignment. Whether you are sitting down normally or working on your computer, ensure that you are sitting straight. Avoid slouching. The same rule applies when you want to lift an object. Keep the lower portion of your back in its normal position at all times. Move as close to the object as you can. Don't twist your body. Always do a side step or a pivot. Set your feet into a comfortable and solid wide base of support while lifting. Keep your abdominal muscles contracted. Bow slightly using the hips and squat. Keep the head upright and your shoulders up. Pushing up from the knees and using your own momentum will help you lift the object. Proper body mechanics are really important in the healthcare facility. This is because they will help to avoid musculoskeletal strain, injuries to members of the staff, injury to the clients, and fatigue. Improper body techniques are the major causes of back pains and posture injuries among healthcare workers in the healthcare facility. A very common form of injury that can occur as a result of improper body mechanics is known as the slip disc or the herniated disc. The slip disc occurs when the subcenter of the spinal disc pushes through a crack in the tougher exterior casing. Some herniated discs cause no symptoms. Others can irritate nearby nerves and result in pain, numbness, or weakness in an arm or leg. Not every disc requires intervention. When required, treatment includes medication, physiotherapy, and possibly surgery. Let us take a practical look at how this injury occurs.
The intervertebral disc is comprised of a soft gelatinous center surrounded by a tough outer wall. When the gelatinous core pushes out through a tear in the fibrous wall, the disc herniates, adding pressure to the surrounding spinal nerves, which causes pain. A herniated disc may be caused by simple wear and tear from repeated movement over time or disc degeneration. With age, spinal discs lose some of their water content, making it difficult to support the load from the above vertebrae.
I hope we can all agree that the herniated disc is not a pretty sight. Knowing the effects of improper body mechanics, healthcare professionals should strive to ensure that they observe all safety and precautionary measures concerning good posture.
It is important for healthcare practitioners to practice appropriate body mechanics while performing their duties in the healthcare facility.